Welcome to the online course on pharmaceutical and medicinal chemistry. Module 2 of this course is drugs, nomenclature, classification and administration. Part C of chapter 2.2 in this module is about drugs acting on hematopoietic and renal systems. The instructor for this chapter is Dr. D. Shravani, Assistant Professor in Chemistry, St. Joseph's College for Women Autonomous, Visakhapatnam. If we recapitulate what we have learned in Part A and Part B of Chapter 2.2, we will remember that Part A of Chapter 2.2 is about CNS drugs and Part B is about PNS drugs and cardiovascular drugs. We proceed further and now we will learn about drugs acting on hematopoietic and renal systems. Learning outcomes. By the end of this chapter, learner would be able to understand the meaning of hematopoietic system, classify and recognize the role of each type of hematopoietic drugs, comprehend the meaning and function of different categories of drugs acting on the renal system, and correlate each category of drug with an example. Contents. Contents of this chapter are hematopoietic system, drugs acting on hematopoietic system, renal drugs, and finally the conclusion of module 2. What is hematopoietic system? Hematopoietic system consists of the bone marrow and the cells that are generated at the bone marrow. That is to say, bone marrow is the place where RBC, WBC and thrombocytes are generated. So, hematopoietic system includes the place of generation as well as the products, that is leukocytes, erythrocytes and thrombocytes. Hematopoiesis is the complex series of events that occur in the blood which result in the formation, proliferation, differentiation and activation of RBC, WBC and platelets. So hematopoiesis is the process wherein these cells are formed, proliferated, differentiated into various categories and also activated. All this genesis occurs in the bone marrow from a single class of pluripotent stem cells. So stem cells are the cells responsible for the production and these stem cells are pluripotent. That means they have plural potency. They can produce different categories of cells like as I told RBC, WBC and the platelets. Blood has three general functions. Okay, now we go into blood. Blood has three important roles. One is transportation. We know blood transports oxygen, carbon dioxide, nutrients absorbed in the intestine to the tissues. So it basically performs the role of transportation. Regulation, it also regulates various phenomena, especially body temperature and other factors. So regulation. Third role is protection. This protection is mostly through the lymphatic system and the WBC. Drugs acting on the hematopoietic system act on blood as well as blood forming organs, and such drugs are called as hematopoietic drugs. Hematopoietic drugs are further classified into anticoagulant and coagulant drugs. We know what is coagulation. So anticoagulant drugs prevent coagulation of blood, whereas coagulant drugs contribute to coagulation. And also anti-anemic drugs. We know what is anemia. So anti-anemic drugs help in prevention or control of anemia. Now let us look into anticoagulant and coagulant drugs. As I already told, Anticoagulant drugs prevent or prolong the coagulation time of blood. Sometimes the coagulation time of blood is extended by the use of anticoagulants. Sometimes totally it is stopped. Anticoagulation can be achieved by suppressing the factors needed for coagulation or by stimulating the normal anticoagulants in the body. Body has anticoagulants the body has inbuilt anticoagulants. So these anticoagulant drugs, they either stimulate the existing anticoagulants or they suppress the factors needed for coagulation. Now, these are the two important categories of anticoagulant drugs, heparin and 4-hydroxycoumarin. Now, we look into coagulant drugs. Drugs that are useful for the clotting of blood are called coagulant drugs. Coagulant drugs include vitamin K and its analogues, along with proteins, amino acids, and plasma. You can see the structures of vitamin K1 and K2. Antianemic drugs. Anemia is a condition wherein the level of hemoglobin in the blood is less than optimal. That is, there is a lower level of hemoglobin in the blood. And hemoglobin, as we know, is very important for oxygen transport. Most anemias are deficiency diseases which are caused by deficiency of iron or deficiency of vitamin B12 and folic acid. Iron deficiency can be overcome by treatment with ferrous sulfate, ferrous fumarate, glycine sulfate, etc. We know iron deficiency is a common problem among children. So whenever a particular person is detected with lower levels of hemoglobin, the most common method of addressing the problem is give iron capsules or injections, ask the person to eat iron-rich foods. So that is how iron deficiency is addressed. Vitamin B12 also causes anemia, and vitamin B12 is called cyanocobalamin. So if there is vitamin B12 deficiency, the tablets in the form of vitamin B12 are given to address the condition of pernicious anemia, a kind of anemia that is called pernicious anemia, and vitamin B12 tablets are given to address that problem. Folic acid deficiency also causes macrocytic anemia, a condition in which the level of blood platelets, we have seen WBC, RBC and platelets or thrombocytes, level of blood platelets and polynuclear erythrocytes is decreased. You can see here vitamin B12 and folic acid. Next, we move on to the later half of the chapter. As we thought in the beginning, we will be discussing about the hematopoietic system, drugs acting on the hematopoietic system, and now renal system and renal drugs. What is renal system? Renal system is simply the urinary system. It includes four major parts: kidneys, ureters, bladder, and urethra. You can see here a rough sketch of the renal system. And renal drugs are the drugs which act on the renal system. They are classified as diuretics and antidiuretics. So here in this chapter, we will speak only about the diuretic drugs. Diuretic drugs increase the rate of urine formation. They contribute to urine formation and elimination of minerals, especially sodium, chloride, and water from the body. Diuretics are very important in the treatment of a variety of medical conditions such as nephrotic syndrome, diabetes, nutritional edema. Edema is a swelling in the body due to accumulation of water or fluids. Nutritional edema. Cirrhosis of the liver is a lethal condition. Cirrhosis is a complaint pertaining to the liver. It will also result in accumulation of fluid inside the body. Hypertension is blood pressure, higher blood pressure. Edema in pregnancy, that is swelling or some kind of fluid retention during pregnancy, and lower intraocular and cerebrospinal fluid pressure. That is to lower that pressure. Also, diuretic drugs are used. Diuretics can be broadly categorized into 5 categories. Purines or xanthine diuretics, aldosterone inhibitors, high ceiling or loop diuretics, carbonic anhydrase inhibitors, thiazide diuretics. So purine or xanthine diuretics are the structural analogues of purine and xanthine, and these compounds are weak diuretics. They act by inhibiting the absorption of sodium chloride and water in the renal tubules. So once the urine is formed in the kidneys, it will travel into the tubules, but in the tubules it is again reabsorbed. Now these drugs prevent that reabsorption. The examples for this category of drugs are caffeine, theophylline and theobromine. You can see here the structure of theophylline and theobromine. Aldosterone inhibitors. Now, aldosterone is a natural hormone secreted by the adrenal gland. And what is its role? It promotes the reabsorption and retention of the two ions, sodium ion, chloride ion, and water in the distal tubule. So, it promotes reabsorption. Now, aldosterone promotes reabsorption. Aldosterone inhibitors inhibit aldosterone. That means reabsorption is prevented or reduced. Substances which inhibit the action of aldosterone are called aldosterone inhibitors, and they are good diuretic drugs. Earlier we have seen weak diuretic drugs. These are good diuretic drugs. They are spironolactone and metirapone are the two prominent diuretic drugs. You can see here their structure. High ceiling or loop diuretics. Loop diuretics are powerful diuretics which inhibit reabsorption of water and sodium from the loop of Henle. We have seen distal tubule, from different places the reabsorption can be prevented. High ceiling or loop diuretics, they prevent reabsorption in the loop of Henle. They act for relatively shorter duration of time, and they essentially contain the carboxylic acid group, that is a COOH group. About this kind of a diuretic, you have a detailed chapter later, and we will learn more about this kind of diuretics in that lesson. They cause a lot. These kind of diuretics cause a loss of sodium chloride and potassium ions. Bumetidine and furosemide are the important categories of drugs in this class. You can see here the structure of bumetanide and furosemide. Carbonic anhydrase inhibitors. The fourth category of diuretic drugs are carbonic anhydrase inhibitors. The enzyme carbonic anhydrase is present in the kidney. Earlier we said the hormone is secreted by the adrenal glands. This particular enzyme is present in the kidney, eye, and the pancreas. Within the proximal tube, we have seen about distal tubule earlier. Now we are speaking about the proximal tubule of the kidney. Carbonic anhydrase provides a supply of hydrogen ions, H+ ions. These ions are exchanged for sodium in tubular fluid so that the body sodium is conserved. So these drugs, this particular enzyme, we are not speaking of the drugs, we are speaking of the enzyme. What is that enzyme? Carbonic anhydrase. What does it do? It supplies H+ ions. It is giving H+ ions because H+ ions are released into the urine. Sodium ions are absorbed back. So this particular enzyme helps in the retention of sodium ions in the body. So what are you giving in the form of a drug? You are giving an inhibitor to the enzyme. So once you provide the inhibitor to the enzyme will not supply H+ ions. If H+ ions are not released into the urine, sodium ions will not be reabsorbed. That means sodium ions will be excreted through the urine. so that sodium and bicarbonate remain in the tubular fluid and are excreted. Acetazolamide and methazolamide are useful carbonic anhydrase inhibitors. You can see here the structures of acetazolamide and methazolamide. Finally, we come to the last category of thiazide diuretics, benzthiazidines, thiazidines, and also called as thiazides, possess varying degrees of diuretic action. The main site of action of these compounds is the distal tubule. Earlier also we have seen an example where the drug acts at the distal tubule. Here also it is the same. The thiazide diuretics inhibit the reabsorption of sodium and chloride ions. As you can see, in all these examples, they somehow prevent reabsorption. So reabsorption is a natural process occurring in the renal system. So these drugs somehow prevent or reduce the reabsorption. So more sodium, chloride, sodium ions, chloride ions, and water, potassium ions, they are lost through urine. Some of the thiazide diuretics are chlorothiazide and benzthiazide. You can see here the structures of chlorothiazide, and let us conclude now. In a nutshell, in the 2.2 chapter, we have learnt it under 3 parts. Part A, Part B, and Part C. Part A was concerned with CNS drugs. In the CNS drugs category, we have learnt about non-selective CNS depressants, non-selective CNS stimulants, and selective CNS modifiers. Then we moved on to Part B. Under Part B, we have learnt about PNS drugs. PNS drugs refer to peripheral nervous system drugs and cardiovascular drugs. Under PNS drugs, we have learnt about sympathetic adrenergic stimulants and blocking agents. We have also learnt about parasympathetic acetylcholine stimulants and blockers. We call them as cholinergic drugs, anticholinergic drugs. And under cardiovascular drugs category, we have learnt about hypertensive drugs, antiarrhythmic drugs, cardiotonic drugs, vasodilators, and anti-hypercholesterolemic drugs. In the part C, that is the current video, we have learnt about the hematopoietic system and anticoagulants, coagulants, and antianemic drugs. We have also learnt about the renal system and diuretic drugs. Under diuretic drugs category, we have learnt about purines or xanthine diuretics, aldosterone inhibitors, high ceiling or loop diuretics, carbonic anhydrase inhibitors, and thiazide diuretics. Now, let us conclude Module 2 as a whole. Module 2 is drugs, nomenclature, classification, and administration. In this module, we have learnt about nomenclature, which was 2.1. Under nomenclature, we have seen there are 3 types of names for each drug. The chemical name, which is also the IUPAC name, generic name, and trade name. Trade name is given by the company manufacturing the particular medication, whereas generic name is universal and generic name is indicative of the effect generated by the particular drug. Then we have also looked into drug administration, which was 2.3. Nomenclature is 2.1. Drug administration is 2.3. Under drug administration, we have learnt about enteral, parenteral, and other routes of drug administration. Enteral route refers to administering the drug through the mouth or involving the alimentary canal or the digestive tract. Parenteral route pertains to administering the drug outside of the digestive tract, and other routes we have learnt in 2.3 under administration of drugs. The current chapter comes under classification of drugs. Classification of drugs is a big topic or is a big chapter. So this classification of drugs is divided or subdivided into 4 parts: 2.2, 2.2a, 2.2b and 2.2c. Under classification, basically we have seen that drugs can be broadly classified into 2 categories: chemotherapeutic agents and pharmacodynamic drugs. Under chemotherapeutic agents, we have seen that they can be antiseptics, antibiotics, antibacterials, antitubercular, antihelminthic, antiparasitic, antimalarial. All those come under chemotherapeutic agents, and a chemotherapeutic agent acts on the microbes body and controls or prevents infection. Now, pharmacodynamic drugs act on the host body. Chemotherapeutic agents act on the microbe or the disease-causing microbe, and pharmacodynamic drugs act on the host. Pharmacodynamic drugs are again subdivided as CNS drugs, PNS drugs, cardiovascular drugs, hematopoietic drugs, and renal drugs. We have learnt about each category and subcategories of pharmacodynamic drugs. So with this chapter, we have concluded module 2, which is nomenclature, classification, and drug administration. Thank you. All the images in this video are copied from the open sources on Google. The instructors of this chapter are Dr. D. Shravani and Dr. P. Sharada.